co-chair, Dr. Hani Hafez Lutfi, and I would like to welcome you to this session, session number 25, the technology session. If I could ask you to take your seats, please. So, the first presentation will be by Dr. HANAN GEWIFAL, Professor of Diagnostic Radiology in Breast Imaging and member of the National Council of Women here in Egypt, Dean of the Applied Health Science Technology in Cairo. Thank you for your kind attention. Professor HANAN GEWIFAL.
Yes, would you please start? Yes. Thank you very much, Dr. Mariam, for such introduction. Good afternoon. I am delighted and honored to participate in this conference. Thank you for the organizing committee, and thank you for the International Society of Radiology for making this conference take place on Egypt land this year. Just a quick introduction. I work at MUST. MUST is one of the first private universities in Egypt. Our slogan is "Information is Power." I am a Dean of Applied Health Science. Our slogan in the college is "Learn to Serve." This is our campus, and this is our hospital. We have 14 colleges, 7 of them dealing with healthcare industry. Also, I work as WAFI, Women and Fetal Imaging, as a consultant of breast imaging. I quickly will realize the importance of effective communication. Breast cancer, the problem. I will just touch base with mammography and mammography tech errors. Sustainable development goals. Are we aligned? Is it aligned with our work? And then I will end with take-home message. It's very important to know that people are the backbone of the healthcare system, and artificial intelligence is a good colleague. Effective communication in mammography is the key to successful patient care. Why? Because it establishes and maintaining good relationships, to creating positive experience, and is a very important element to show respect. Good communication entails to be concise, to be clear, and caring. Communication means transformation of information from a place to place. First impression lasts, so be careful. Patients need information, reassurance, and compassion. Not only this, but they need medical care in addition to personalized medical care. One size does not fit all. Medical dehumanization. We get used to things. It is how we adapt. Over time, patients become objects or work subjects. They feel less like humans and more like cases. We all must know that even while patients are being provided with high-quality technical care, they are often dehumanized because they are taking off their clothing, called by their condition sometimes rather than their name, subjected to procedures they do not understand, and by doctors they do not know. Working with passion is certainly a plus for all of us. Being a member in healthcare professional team, it requires complicated analytic thinking. Awareness of a patient's humanity may become a distraction that affects your ability to do your work. Turning off empathy, dehumanizing, protect us from sadness associated with patient health condition, a psychological shield that enables us to continue caring day after day. We need to acknowledge and respect patients as human beings while still protecting ourselves from stress or burning out. Breast cancer is a global burden disease, and I believe it is a public health problem. Breast cancer has no borders. Breast cancer incidence is increasing in developing countries. Breast cancer has many types, and I know all of you know this. We also have a lot of imaging procedures to image the breast, like mammography, digital mammography, ABUS, automated breast ultrasound, contrast-enhanced mammography, and positron imaging mammography and MRI. What is a mammogram? Simply, a mammogram is an X-ray picture of the breast. We have two categories of mammography. We have screening mammography and diagnostic mammography. Diagnostic mammography entails that there is a radiologist on site. Are mammograms painful? Everyone experiences differently, and this is the responsibility of diagnostic mammography. This is considered the most important slide in my presentation. The responsibility of mammography tech is to quality control procedures, patient care, optimum breast positioning, and compression, while the radiologists take over of the reporting and the ultrasound. There are mammography text errors. We can classify it into communication errors and technical errors. Both errors affect women as well as doctors. Let us start with the errors that affect women. Cold hands during doing the mammogram or cold gel during ultrasound. Definitely, we don't want to see this face during our procedures. Facial expression is very dangerous, that reveal bad news, and we have to take care of it. Also, the opposite, no reassurance or mask face is not needed. Another, interpreting result is not the duty of diagnostic mammography. Now, what are the technical errors for doctors? Switch names, which we usually confronted in every day. Please don't be shy to ask your patient the spelling of the name, particularly we used to write it in English. Didn't get history of prior intervention is very important. Didn't ask if the patient has been imaged before. This is crucial for mammography. You have to know the last prior mammogram, the date of it, to start your examination. Didn't mention the patient had a certain procedures before. Two important technical errors, that the inframammary fold should be seen in the MLO view. Also, the posterior nipple line, PNL, which is the line from the nipple to pectoralis muscle, in CC view and MLO view should be equals or different 1 centimeter, not more. There are a lot of learning resources. One of them created by the IAEA Human Health Series, Quality Assurance Program for Digital Mammography. Also, we have the American Society for Radiographic Technology, and there are quite good articles you can serve. October definitely is the breast cancer month, so be ready for the months this year. This quote, I would like every mammography tech to put it in his back mind. Mammograms are really sort of a gift. You can either catch something early, so she will be a lucky woman, or count lucky stars because nothing was discovered. Either way, you are ahead of the game. The SDGs, our work with good education, prevention of cancer, early detection, all are aligned with SDGs. The take-home message is the more you get better at what you do, the more you will be angel of mercy for women, will never forget or feel grateful to your work. And thank you so much. I wish to thank Professor Hani Hafiz, Professor Dina Al-Husseini, Professor Tariq Dayasti for making this happen. Thank you.
Thank you, Professor Hanan, for her excellent talk. I think we'll delay the questions till the end of the session. It's a pleasure to introduce Dr. Nirvan.